Hi, I'm Dr. Boomy, and we're going to be talking about constipation. The best way to approach constipation is by age. So let's start off with our newborns. So if your newborn does not have a stool in the first 24 to 48 hours, there definitely will be a medical workup done to rule out diseases like cystic fibrosis, Hirschsprung's, thyroid, and those we will actually touch upon in another video. Now, our newborns tend to have up to 10 liquidy stools a day, but our breastfed babies, as they pass the 1 month mark, can actually have one stool every 7 days. So again, long as the stool is liquidy, long as they're not fussy, long as they're eating well, that is actually normal. The other thing our newborns and infants do experience is something called infant dysphagia. So they'll be straining, they'll be turning red, they'll be crying, and then in 10 minutes, they'll have a stool and it'll be liquidy, it'll be normal. So again, nothing to worry about. Now, if your infant does have hard pellet stools, then that is considered constipation, and we do want to address it. And majority of the time, it is like a food sensitivity, so talk to your physician about dairy elimination or other foods. Now, once we do start solid foods in our infants, we are definitely going to see an increase in constipation then. And when we're looking at that point, we're looking at the definition of a constipation now being having 2 or less stools in a week, having hard stool, having large diameter stool, straining, discomfort, even sometimes rectal bleeding. So the best thing is prevention. So when you are introducing solid foods, balance out the fiber intake. Increase foods such as pears, peaches, spinach, green beans, peas, using multigrain or barley rice instead of rice cereal. You can also even use some probiotics. Also, make sure you do add water now in a sippy cup, 1 to 2 ounces every time you give a solid meal. So the next time we are seeing worsening of constipation is going to be in our toddlers. One, because of the diet, but also because of potty training. So again, with the diet, we make sure we have good intake of fiber. We also want to make sure we are getting plenty of fluids, because now after 1 year old, we actually want 32 ounces of fluid or more a day. But also we want to make sure it's not too much milk, and we want to limit the milk intake to no more than 20 ounces a day. Again, probiotics are always a good thing. And then when you are starting the potty training, make sure that your toddler is ready to train, because if they are not ready to train, they will hold their stool. And once they hold their stool, we get into that vicious cycle of holding the stool, getting constipated, and progressively getting worse. The other thing you want to do is have a footstool if you're using an adult potty, because again, that's going to give them foot support, but also raise their knees above their hip, so that relaxes the pelvic floor to help them have a stool. So if you're doing all of that and your child is still getting constipated, we do start with juice, and we usually are recommending prune juice. In those who are older than 4 months of age, we go ahead and say to start with 2 to 4 ounces. Those who are in their toddler years, you can do 6 to 8 ounces a day to see if that will help. If we're still continuing to get constipated, your physician will talk to you about certain laxatives, and the most common one that we use in our children is polyethylene glycol, which is a powdered form. So it's great because we can actually titrate it to where we need it. So if we have mild constipation, we're just going to start with a small dose and increase until your child has 1 to 2 soft stools daily. If it's severe constipation, we'll actually do a high dose to clean out and then start lowering it, and then have you stay on that for a few months. Now, when we're looking at school-age children, we want to ask them about their habits, because, we don't go into the bathroom with them anymore. And so a lot of them, we won't even know they're constipated. The other thing is you want to make sure that you're encouraging them to go to the bathroom, because a lot of them do not like to go into the public restrooms. And lastly, if your child is having chronic constipation, which means it's been going on for 2-3 months, if they're having rectal bleeding, if they're having abdominal distension, vomiting, weight loss, please seek medical attention. Thank you for listening, and we'll see you next week.